My name is Josee. I work here at True Balance in St. Albert. I am a medical esthetician, and today we'll be going through one of my favorite services, chemical peels. I do love skincare in general, whether that be microneedling, beauty booster, dermaplaning, you name it, I do it all. And I do specialize in medical pedicures as well as the full aesthetics. So that's just a little bit about me. So optimally, I like to see 3 treatments. A series of 3 is going to treat that skin the best, and we can use different chemical peels to achieve those results. Today, let's focus on calming down that acne, kind of bringing down some of that inflammation and that redness as well. So today we'll be using that acne lift. There is some discomfort to it, so you might feel a little bit of like tingling, some burning. Not too unbearable, but it does sit on the skin for about 5 to 7 minutes. And then once that comes off, we're going to be using some products to complement that. We have gone over some pre-care, so just making sure that you're not on your retinols or any really active ingredients, any prescriptions for your acne and or benzoyl peroxides. And then your post-care is going to look similar to that, just avoiding those active ingredients for that acne. We do provide you with a post-care kit as well with products you're going to want to use for 5 to 7 days post. And then just being mindful of your sun exposure. You're going to want to wear your sunscreen like always, but especially in these next 5 to 7 days, just to minimize that possibility of damaging the new skin that comes in. And then we will pre-book you for your 4 weeks, and we'll do that again, and we'll kind of go from there. So we're using a gel salicylic cleanser, and so this is a 2% salicylic acid. This is going to help with reducing some of that inflammation, help with reducing some of that redness, and it also helps with clearing up some of that bacteria that comes with acne. I know it can be very tricky once it starts spreading and growing, so we're going to try to keep that under control. You do get a little bit of a sensation with your salicylic cleansers just because it is an acid. It can cause just some activity on the skin. Shouldn't be anything too crazy. With Brooklyn, we'll do a series of 3. We will check in on her 4 weeks post to see how this chemical peel, because we use the acne lift, has reacted with the skin. And if we see results from there, again, we'll hit it so that we can get that inflammation down, help with that acne scarring, and get that bright, smooth skin. And then we'll go from there. Cream and a retinol enhancer. This is going to help that cell turnover work a little bit quicker, and with acneic clients, because the cell turnover is a little bit slower, we get that sebum, that excess oil build up, kind of hanging on to those dead skin cells. So that retinol is going to be really beneficial to help get that turning over and helping keep it in an active state. Now with results, Brooklyn will see results pretty immediately. As for the scarring, it will take us those 3 treatments to start seeing those results come in. But after a chemical peel, we tend to see the skin is like glowing, it's softer, it feels brighter as we shed as well. So our dead skin cells are going to shed off. We're going to flake and peel. That new skin coming in is going to be radiant and just brighter overall. It does last, I would say, a few weeks, and that is why we recommend doing a series of peels, because that is going to be the most beneficial to have that skin constantly turning over until we achieve those results. Once we get Brooklyn to where she wants to be with that acne scarring minimized, then she'll notice her skin is bright and healthy on its own after we've done all that groundwork for her. And then last but not least, SPF. So your sunscreen is probably the most important product of your routine. With sunscreen, we are minimizing the damage that we are getting from the sun, obviously, but then also with any free radical damage that's happening outside. Okay, so this is your post-care kit. All the instructions are going to be on the back on how to use it. So when you open it up, you'll have your cleanser, your brightening serum, your cream, a mask, and then an SPF. Kind of the best way to remember this is you're going to cleanse and use your serum every day, morning and night, and then the max will be your night cream and the SPF will be your day cream. And then the mask I would suggest starting to use about 3 days post. It can cause some irritation just because it is a vitamin C, it is enzymatic, so it does have some bite to it. If you want to use it about 5 days, that is great too. But these will all help with maintaining those results and achieving that brighter, smoother skin. And then if you have any questions, you can always refer to how to use it on the back. And then you have my card, you have my information, so you can always email me if you have any questions.